Good afternoon, and thank you for joining us for today's briefing. I want to start this afternoon by updating you on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 15,101 positive cases confirmed, an increase of 60 from yesterday. A total of 1,329 patients are in hospital with COVID-19, 845 who have been confirmed as having COVID, and 484 who are suspected of having the virus. That represents a total change of 24 from yesterday, including an increase of 4 in the number of confirmed cases. A total of 44 people last night were in intensive care with confirmed or suspected COVID-19, and that is a decrease of 6 since yesterday. I'm also able to confirm today that since the 5th of March, a total of 3,560 patients who had tested positive for the virus have been able to leave hospital, and I wish all of them well. Regrettably, I also have to report that in the last 24 hours, 9 deaths have been registered of patients who have been confirmed through a test as having COVID-19. That takes the total number of deaths in Scotland under that measurement to 2,270. It's worth bearing in mind that fewer deaths tend to be registered at the weekend than on other days of the week, and that is almost certainly part of the reason why today's figure is relatively low. And as always, I want to stress that these numbers are not simply statistics. They represent individuals who are loved, who are valued, and whose loss is a source of grief to very many. So I want to send my deepest condolences to everyone who has lost a loved one to this virus. As Health Secretary, I also want to once again thank those working in our health and care sectors. That thanks is due to all staff in care homes, in GP practices and COVID assessment centres, emergency dental and eye care, paramedics, procurement staff, people working in NHS 24, and the many cooks, cleaners, porters, and maintenance staff who make all of this possible. What you do is essential to the health and well-being of our country, and all of us owe you a huge debt of gratitude. I have one issue that I want to update you on before I remind everyone of the guidance in place right now. And it is directly relevant to the point that I have just made about the importance of frontline workers. Social care workers have always played a vital and valuable role, but the importance of what they do has never been more apparent than during this emergency period. Several employers already offer employment contracts to social care workers, which are broadly in line with the Scottish Government's Fair Work principles, but it is clear that others do not. At this time, even more than is usually the case, that cannot be justified. It is not acceptable for any social care worker to be faced with the impossible situation of testing positive for the virus, knowing that their weekly income will reduce to only the level of statutory sick pay. So we have intervened to ensure that social care workers do not face that situation, but receive better levels of sick pay. It is also the case that for some social care workers, their contract of employment offers no cover for death in service. Again, that is not acceptable. So our intervention will also ensure that in the tragic circumstances of this pandemic, where a social care worker dies, their next of kin will receive financial support. That sick pay fund will ensure that care workers who test positive for COVID-19 will receive sick pay above the current statutory level of £95.85 a week. The death in service benefit will see a one-off payment of £60,000 made to a named survivor of any social care worker who dies without death in service cover in their contracted pension arrangements. And both these arrangements will be retrospective. Over the course of the next week, we will work with local government, with social care providers and trade unions on the details. But our aim is clear. This Scottish Government will provide fair benefits for care workers. They have continually shown in recent weeks how vital their work is, and we must help them as they provide help to those who need it. The people in our health and social care services are doing a tremendous job, but they need us to play our part. And part of that is by following the rules that we have put in place. So I think it's essential today to remind everyone, because it is hugely important, what we mean by self-isolation and what we are asking you to do. That message may have become confused in the last 24 hours because of events in other parts of the United Kingdom. So let me be clear what we mean here in Scotland. Self-isolation means the following. If you think you have the virus, if you have a persistent cough or a fever or loss of taste and/or smell, you should self-isolate at home for a minimum of 7 days. In that time, you should get tested if you can, bearing in mind that testing is now open to anyone over the age of 5 who has symptoms. At the same time, anyone in your household should self-isolate for 14 days to see if they develop the virus, and if they do, they should isolate for 7 days from that point. On the 8th day, if you do not have any more symptoms, you can go back to the lockdown measures that apply across the country. Self-isolation is not the same as lockdown. When you are self-isolating, you should not go to the shops or out for exercise or to help others. You should not leave the house for any reason. Instead, if you need anything, you should have it delivered to you, whether that's by family and friends, local volunteers, supermarket delivery services, or by phoning the National Helpline on 0800 111 4000. If you're concerned about vulnerable people who are with you or that you care for, again, phone the National Helpline, 0800 111 4000. I cannot emphasise enough how important self-isolation is as part of our efforts, your efforts, to tackle the virus. It is all about breaking that chain of transmission. And I encourage anyone who has symptoms to follow these rules completely. We hope, as the First Minister indicated, that later in the week we'll be able to confirm that some lockdown restrictions, especially relating to outdoor activities, will be relaxed. But even if those restrictions are relaxed, some key advice, including what I've just read out on isolating if you have symptoms of COVID, as well as on physical distancing, washing your hands, and the use of face coverings, will remain the same. In fact, they will become even more important to avoid undoing all the progress that you have made through your sacrifices and your compliance with the rules, particularly as we move into test and protect. For the moment, however, all our key public health guidance remains unchanged. So please stay at home, except for essential purposes such as daily exercise, buying essential items such as food or medicine, or going to essential work which you cannot do from home. You can exercise more than once a day, but when you do leave the house, stay more than 2 metres from other people and do not meet up with other households other than your own. Please wear a face covering where appropriate, for example, if you're in a busy shop or in public transport, and wash your hands thoroughly and regularly. I know that this is a bank holiday weekend and that talk of emerging from lockdown probably makes following these restrictions even harder. But the fact that we have stuck with them so far, that is what makes it possible to think about relaxing them. By doing the right thing, all of us, all of you, are helping to slow the spread of the virus, protecting our NHS, and you are saving lives. So thank you to every single person who is doing that. I'm now going to turn to Professor Leitch, our National Clinical Director, to say a few words.
Thank you, Cabinet Secretary. I'd like to today acknowledge the efforts of all colleagues across the pharmacy profession, working hard to ensure people continue to have access to their medicines, Whichever setting pharmacists and their teams are working in, they are all playing a critical role as Scotland continues to face the challenge of slowing down the spread of COVID-19 in order to save lives. In Scotland alone, to date, 326 pharmacists and 226 pharmacy technicians have returned to the register to offer their services during this pandemic. All 1,258 community pharmacies across the length and breadth of Scotland are at the front line, supporting the National Health Service during this pandemic, and are playing a vital role in ensuring our medicines are effectively and safely dispensed. Community pharmacy teams up and down the country are working to serve their local communities, providing professional healthcare advice and treatment during the current outbreak. During this pandemic, community pharmacy teams have stepped up by extending the minor ailment service, providing advice, treatment or referral for everyday conditions, including the symptoms of COVID-19, to high-risk groups such as the elderly, children and those who cannot afford to self-care. Unlike many other public services and businesses, community pharmacies have remained open during the entire pandemic, so please do be kind if you have to wait just a little longer than normal. Again, community pharmacies will stay open where they can during this May bank holiday weekend. I also want to acknowledge those working in the pharmaceutical supply chain who are ensuring that the medicines supply chain continues uninterrupted. And finally, I'd like to acknowledge the leadership and work of Scotland's Chief Pharmaceutical Officer, Rosemary Parr, and her team in government. In partnership with the directors of pharmacy and each of our health boards, their leadership has been crucial to this pandemic response. So to each of you, thank you for everything you've done. Cabinet Secretary.
Thank you. And now to Professor Fiona McQueen, our Chief Nursing Officer.
Cabinet Secretary, thank you very much. In recent weeks and months, our country has pulled together in a way that we've never quite seen in recent times. We've followed rules that have been incredibly difficult to follow, and all to protect each other from COVID-19, but also at the heart of what our decision-making has been protecting, staying at home to protect our NHS. Our clinicians have been outstanding in their dedication and their professionalism. Our nurses, midwives, pharmacists, doctors, all across the country have been outstanding in their professionalism and their dedication. I've often also shone a light on those clinicians who we wouldn't normally think of when we automatically think of the NHS. Those who support people with a learning disability, our nurses and clinicians who work within prisons and other bespoke areas where people don't traditionally think of clinicians working. And that work has also gone on tirelessly. Today, I would like to shine a light on another group of what I would think of as hidden workers who literally keep our hospitals and our health centres open 24 hours a day, 365 days a year, and that's our facilities and our estates team. Without them, we truly could not open our doors to care for people, and clinicians would be bereft of supplies, of a clean environment where they can care for their patients. So we have over 5,000 cleaners cleaning tirelessly over 2 million square metres of estate, often time and time again, like perpetual motion, not just to keep the place looking clean, but incredibly important to prevent the spread of infection and the key parts of our infection prevention and control teams. 16 million meals are served every year throughout Scotland, and our catering staff work tirelessly so that patients have good, nutritious meals, which are a real part of medicine to help people recover. And similarly, we have over 3,000 porters transporting pieces of equipment, but in particular, I'd like to notice the way that our portering teams transport patients around our hospitals. Intuitively, they know whether it's a kind, gentle word that patient and their family needs, or some friendly encouragement to get them from one destination to another. And they're working 24 hours a day to help make sure our health service runs efficiently, effectively, and is there for all of us when we need it. Similarly, over 70 million pieces of laundry is laundered, again, to keep patients comfortable, but just as importantly, to make sure that we're preventing infection and as part of our infection prevention control, our clean towels, our clean sheets and pillowcases are so important in our day-to-day work. And then finally, our estates team, whether it's our plumbers or our electricians or our hospital engineers. Again, paying fundamental attention to the safety of environment. Over 4 million square metres are kept safe by our teams, making sure that our air conditioning systems are working well and that patients have lights, our theatres have an electrical supply. Right over 24/7, our estates team work tirelessly and often are hidden and not seen by the general public. So a huge thank you to our estates, our facilities team for all that you do to make sure that the people of Scotland have an outstanding NHS and our clinicians can do the job that they need so badly to do. Thank you.
Thank you very much, Fiona and Jason. Now let's turn to the journalists who've joined us this afternoon. And first is Ryan Mayer from STV.
Thank you very much, Cabinet Secretary. In relation to Richard Leonard's comments this morning, he says that it was irresponsible to send 921 untested hospital patients into care homes back in March. Can I ask you, do you think this approach was responsible?
So what I want to do, if I may, Ryan, is just take us back to the 3rd of March, when in Parliament I pointed out that the reasonable worst-case scenario that we were planning for in terms of the impact of the virus, and this was taken from the SAGE, the Scientific Advisory Group for Emergencies, estimation at that time about how the virus could impact on citizens in Scotland as well as the rest of the UK, was that 80% of the population would be affected and that 4% of that number would require hospitalisation. That meant that at that point, we, I think rightly at that point, focused a huge amount of effort into reprioritising what our National Health Service was doing in order to ensure that we would not be overwhelmed if that volume of hospital cases came to us, as we had seen in other parts of Europe, making sure that we had to take those difficult decisions about ending important parts of healthcare like elective work and our screening programmes, ensuring that we purchased and brought in sufficient ventilators to scale up the number of ICU beds that we had. Now, as the First Minister has said, I too, if I had known everything I know now, had known then we may have made different decisions about whether or not every patient who was being discharged from hospital who was a COVID patient was tested to ensure that they were negative. What is the case is that they were discharged from hospital because they were clinically well. And that, as always, even though we looked to bring down the number of delayed discharges, an objective shared across all the parties in the Scottish Parliament for many years, in fact, what happened even in those circumstances is that every single case would be clinically assessed in order to be confident that they were ready to be discharged, they were clinically well, and that the risks assessments that always should be made would be made and continue to be made by social work staff and others to determine with the patient and their family where was the right place for them to go. The majority went back home, about a third went into care homes. So that is the circumstance in which all of those decisions were taken. And as I've said before, and First Minister has said before, there will undoubtedly be, as we look back over our handling of this pandemic from what we knew in the very early days about this very new virus and how it transmitted itself and the impact it had, to how we are learning, indeed the learning of scientists and clinicians the world over has developed over that time and undoubtedly will continue to develop, then there will be times when we understand with the new information that decisions that were made previously, if we'd had the new information then, we might have made those different decisions at that point. But that is the basis on which we took the decisions in March that we took, using that worst-case scenario estimate to ensure that our NHS wasn't overwhelmed. And the point about our NHS not being overwhelmed is that it was then free to treat everyone who needed its clinical care. And that, regardless of any other decisions and how people might judge those, I think that decision has to be judged as the correct one. Aileen Clark from BBC. Aileen, are you there?
I am. Sorry, Minister. Minister, who would have thought before this that we would have had the courts getting involved in deciding who should be running a care home? And now we hear that the police are investigating 3 deaths at the Home Farm care home on Skye. In the very near future, Minister, will you consider a full-scale review of the care home sector?
So the involvement of the court in Home Farm Care Home, of course, is as a consequence of the action of the Care Inspectorate, and they have had that power previously and are exercising it in that respect of that care home, where they are seeking to have the care home deregistered. And as you and I'm sure viewers know, the NHS in Highland, the NHS have stepped in to ensure that there is adequate staffing, adequate infection prevention and control, adequate PPE, and all the right measures are taken to ensure the care and the protection of those residents there is as we would all want it to be. And the involvement of the police in terms of the Lord Advocate's recent decision that death in care homes and of workers should be reported through the Procurator Fiscal procedures is a decision for the Lord Advocate. To get specifically to your question, Aileen, I think I'm on record as saying that there needs to be a look at whether the way that we currently have that mixed economy of provision of social care and care homes, where we have the private sector involved, we have the independent not-for-profit sector involved, we have third sector charities, and we have public agencies through our local authorities, whether that is the correct approach going forward. And I think it is entirely right that we review that and consider with the public in Scotland whether or not that should be changed. If it should be changed, in what way should it be changed? And in what way should all of that be funded and taken forward so that we ensure that we have the best quality of care for our older people, regardless of where they are, whether they are in a residential setting, whether they're in their own home, and that residential setting should be their home, it is their home, or their own home, or whether they're in a hospital setting or with family. So short answer to your question, I do believe that that is something that we need to look to as we go forward. Right now, of course, our focus is on dealing with this pandemic, but I think it has shone a light on a number of areas where there have been improvements we want to hold on to, and other areas where we might want to look for improvements in the future. Douglas Barry from PA.
Hi, I'm hoping you can hear me now.
I can, Douglas, on you go.
Just wanting to say, Ms Freeman, there are reports today that the software and the contact tracing strategy could be ditched. While it is a positive that the Louisa Jordan hasn't been needed yet, is this not a negative development given the potential need for contact tracing until a vaccine is found?
So I'm not quite sure, Douglas, what technology you might be referring to. If you're referring to the technology that is part of the NHS Scotland Test and Protect strategy, then there is no intention of ditching that technology. That technology is twofold in its use. The current pilots that it is going through in 3 of our health boards was to test whether or not, having scaled it up from technology we have used in the past for other infectious diseases, having scaled it up to cope with COVID-19 and focused it on COVID-19, whether or not that scale-up was proving effective in its tests. And my understanding is that that has worked. There may be one or two tweaks required, but it has worked as an aid to contact tracers to help them do their job and do their job with less paper filling, if you like, form filling, than would otherwise be required. And the second enhancement to that technology, which we anticipate will come through in June, is an enhancement that would allow the individual who is reporting that they have symptoms and for whom the test is then booked to themselves fill in their contacts over the period that is required, again, helping to speed the process up. So if that's the technology that you're referring to, there is no intention to ditch that technology. There may be other developments elsewhere in the UK about their proximity app, but that is a UK app led primarily by the NHS in England and Public Health England, and I obviously can't comment on how that is progressing or not. Thanks very much. Next is Tom Peterkin from the P&J.
Good afternoon, Minister. Going back to the home farm care home, are you able to shed any light on what it is the police are investigating in this case? And also, given that there were, the care inspector identified staffing issues at the home back in November, has there been a lack of emergency planning, and should operators be held to account more effectively? And could governments and agencies have done more?
So, Tom, the reason why the police will be involved in home farm is as a consequence of the decision the Lord Advocate took that deaths in care homes from COVID-19 should be reported through the procurator fiscal process, and the police therefore have an engagement in that in the early stages of it. The other parts of that process are really for the Lord Advocate. In fact, the decision is entirely for the Lord Advocate to take. It's not one that Scottish Government, Scottish ministers can take or should intervene in. And the process and the way the process is followed is under the direction of the Lord Advocate. In terms of the other point of your question, the way the Care Inspectorate works is that it inspects and it finds areas of improvement, and it requires the provider of that care home, whether they're a private provider or any other kind of provider, to take immediate steps to make those improvements. And it then checks whether those have been made, and it continues in that iterative process unless it feels that the circumstance that the residents are in is so serious that it wants to take much more immediate action. So that is how the situation developed in home farm. And in terms of contingency planning, care home providers should have contingency plans. Pre-COVID, they should have contingency plans about what they might do, for example, if there is an outbreak of flu and a number of their staff have to be off because they're ill. How will they ensure that there is a safe staff rota? How will they undertake infection prevention and control in order to prevent the spread of flu or winter vomiting bug or whatever it might be? So that is an expectation of them. It's a requirement for them in terms of their registration. And of course, our health service is always there to support. What we have done most recently, though, is ensured a much more proactive engagement through our directors of public health. Primary care has always had an engagement with local care homes through GPs, but a much more proactive engagement now with directors of public health, nurse directors, medical directors, to make sure that what we expect to be the case in terms of infection prevention and control, what should be the case, the use of PPE, its proper use, the right kind of PPE, is being checked on an iterative basis with all the care homes in a particular board area. I don't know if our Chief Nursing Officer has led much of this work for us and understands very well what we should be seeing and how we should be engaged, wants to say any more.
I know that NHS Highland were available and ready to support the care home, and they now are in and have staff in, making sure that the residents have the very best care they can and as safe as care as possible. And we're now seeing that contact and support with care homes, so that on top of their contingency plans, we will have staff that are available and ready to support, either with advice and guidance or delivering care, rather than relying on agency staff who may not be available or who may not be available to work within that particular care home. And we are expecting to see that daily contact, that support. And many of our care homes are providing splendid care. That they are people's homes providing safe and effective care, but it's an added extra to make sure that every single resident has the care and support they need and is protected from infection.
Thanks very much. Michael Blackley next from the Daily Mail.
Hello, good afternoon. I'd just like to return to the issue of the 921 hospital patients discharged into care homes in March. Can you confirm how many of them had been tested for coronavirus and how many of them subsequently were found to have symptoms of coronavirus? And also, can you confirm if any of these 921 patients went into care homes which had a live outbreak?
So thanks very much, Michael. That data is held by Public Health Scotland, but it's held in more than one format. So they are working right now to get the detailed answers to your questions in a way that is publishable and that they are confident is accurate. They need to take the various sets of data that they hold and bring them together in a way that is statistically robust and makes sense, that they are confident about, so that they can answer that detail of your questions. They have that work underway now, and as soon as they are ready to have that published, then it will be made public. And I hope that's helpful. It is, as we've said, we do want to publish as much information as we can all of the time, and we have increased that over the weeks that have gone by. But the data that we publish needs to be statistically sound and robustly checked in order to be data that you can rely on as well as us. Next is Chris Musson from The Sun.
Hi, Health Secretary. We now know that the 921 hospital patients were discharged to the care homes in March. How many more, even approximately, were discharged from April the 1st to April the 21st, when you announced all patients should be tested from then on? Is it hundreds more? Is it less than that, more than that? But also, can you tell us, the guidance, including the April the 21st policy, wasn't updated until May the 15th. So does this mean there could have been untested patients still going to care homes after April the 21st?
So, in answer to your first question, Chris, that information is published, as I've already explained, and it's usually published into the following month. So I would expect the April numbers, and I'm not going to do a guesstimate, the April numbers that are gathered, checked and made sure of will be published towards the end of May, and then May into June. But the exact date when we would expect those numbers to be available, we will make sure that you and your colleagues know that this afternoon. In terms of the difference between the guidance published on the 21st of April and then the subsequent guidance in May, again, we will look at the detail of your question and ensure that we give you as the detail of an answer that we are as confident about as we can in terms of testing, bearing in mind that the 2 negative tests before discharge for a COVID-19 patient was in that 21st of April guidance. Next, we have Simon Johnson from the Daily Telegraph. Simon.
Hi, Health Secretary. I just wanted to get a bit of clarification. You outlined the rules earlier on self-isolation. And I just wanted clarification whether there was any latitude within those rules for parents to self-isolate in places other than their primary residence to help them with childcare. Are they able to travel somewhere else to self-isolate to help with childcare?
So the guidance, or the rules, if you like, that I spoke about earlier were actually first issued by us on the 12th of March. My understanding is that nothing has changed in those rules, with the exception of the change in the case definition of a matter of days ago, where that was extended to include a loss of taste and or smell. The guidance is really clear about isolating in your own home, your whole household isolating. There is no reference in our guidance about safeguarding, although there is an indication of how about if, for example, in a situation of domestic abuse, that is an unsafe place to be, where to go to seek help, to help you both manage the guidance but also be safe. But other than that, the guidance is really clear. It takes you into Parent Club, the Parent Club website, which has a whole series of advice and support for parents isolating with small children, managing the current situation where, of course, schools are closed, helping parents to manage a whole range of difficult situations in the current lockdown period as their children are not at school, but also touching on what to do in terms of that really important message about isolating at home and what isolation means. It's very different from lockdown, what it means and why it is important. Now, I don't know if Jason wants to say a bit more about that.
The only thing I would add, Cabinet Secretary, is what you said right at the beginning. Scotland was very clear that it was putting in place support. We realised that self-isolation would be difficult for some families and some individuals. So we have support in place. If you can't get that support from family and friends locally, then there is a phone number you can phone, and they will do their absolute best to support what are your individual circumstances, because our guidance, by its nature, can't meet every single eventuality. But the guidance is very clear. It was clear then, it remains clear now. If you have symptoms, you should stay at home.
The other thing I would say, sorry, Simon, yeah.
Sorry, can I just clarify then, if childcare isn't a reason to go somewhere else, is it your view that Dominic Cummings should resign?
So my concern here is to make sure that people in Scotland understand very clearly what our message is and has consistently been. And my worry about the situation that is developing and emerging elsewhere in the United Kingdom is that that public health message, that really important message, becomes confused in people's minds. And they think that maybe it doesn't matter so much anymore. And my message is really clear. You have achieved so much. You've achieved so much that the numbers that we read out every day for the last wee while have shown how much you have achieved. Our NHS has not been overwhelmed. That's down to you. The fact that we will later this week, when it's time to review the current measures, be able to seriously talk about lifting some of those in a careful, staged, planned way is down to you. And my message is, please remember what the guidance is. Please let's not go into reverse here. Stick to what we are advising you to do here in Scotland. Go to that NHS Inform website. It will give you lots of information, lots of advice about planning ahead, thinking about what you might do if you develop symptoms and you have an older person you look after, or somebody who's shielding you look after, or you have young children, what to do. Please stick with that, and that will last as we release the measures that currently are part of lockdown. That remains really important. That's my concern. What happens about any individual currently working for the UK government is entirely a matter for them. Let's go now to Scott McNabb from The Scotsman.
Thank you. Cabinet Secretary, there have been suggestions today that talk of vaccines or even treatments for COVID-19 may be almost academic. as the virus could effectively be wiped out in communities if the rate of infection continues to decrease at the rate it's going. I just wonder, is this prospect part of Scotland's public health contingency response?
So I'm going to go to Professor Leitch for a bit more of the clinical side of that, which he undoubtedly knows much better than I do. But I think where we are as a government, where I am as a health secretary, is that I observe all of these things. There's a lot of opinion and views and research, a great deal of research. Scotland is involved in a lot of that research. I don't think there is anything yet to tell us that we wouldn't want a vaccine or we wouldn't want a treatment or that we know enough about this virus to think that if it is fully suppressed, that we won't need those things. What we do know is that this virus isn't going away. And at the moment, we don't have a treatment for it and we don't have a vaccine. And the work to produce a treatment that is effective, the work to produce a vaccine that works is global and should be supported. But on the particular point that Scott is raising, Jason, I don't know if you want to say a bit more.
So the global scientific consensus is that the virus is not going away with the present scientific knowledge. We don't know how the virus is going to behave into the future. We can't know. There are examples, and I saw them yesterday as well, of small communities where they have got the transmission so low that they appear to be almost virus-free. The Faroe Islands, some of the Channel Islands, these are very small, isolated communities, and they have no travel in and out just now. But globally, the World Health Organization suggests definitely no planning should be made on the basis the virus is going to disappear. So that would be a very dangerous route to go down. However, we will, of course, follow this virus's journey as it goes round the world, as seasons change, as North and South hemispheres have perhaps different experiences. But in the meantime, we have to invest in the research for treatment and for vaccine. And that's what you see Scotland and the other countries of the UK and globally doing. And I would be very, very cautious about taking our foot off that particular accelerator.
Thanks very much. And now Andrew Learmouth from the National.
Thanks, Health Secretary. Just following on from Simon's question there, are you worried that the action taken by Dominic Cummings has undermined the lockdown? That people will now think, well, if he doesn't have to pay it, then why should I?
Well, as I said, Andrew, my concern is to make sure that nothing undermines what we need people to do, whether it is the lockdown rules that are currently applied to you and me and Jason, Fiona and everyone, from which people's abidance by those rules has seen such significant progress, but also that nothing undermines the very important advice that we urge people to take if they have symptoms of the virus. And that is about isolating at home. If they're part of a household, the whole household isolating for 14 days. Because that message is going to stay with us all the way through. However long that route map that the First Minister published last Thursday, however long it takes us to work our way through that, that advice stays with us because it is absolutely critical, not just to protecting your own health if you have those symptoms and the health of those in your household, but protecting your family outside of that household, protecting the community, and as your neighbour does it, should that be the case, they're protecting you. So it is truly an exercise in looking after each other, and it is a really vitally important thing that we do. So my concern is to make sure that people understand that. They understand that we explain to you why and remind you why it is so important to do this, that we remind you that there is help and support there for you if you need that, and that we encourage you, all of us, to stick by that guidance because it really does matter to help us go forward and to make sure that this virus does not rise in its incidence again and we have to go back to where we started from. And finally, we have Tom Magner from Carers World Radio. Tom.
Thank you very much indeed, Cabinet Secretary. I hear the specific answers you've already given on care homes, But to our listeners who are residents and unpaid family carers, it's more fundamental. They tell us that deaths in care homes, while being regretted, are still overlooked. They feel a disconnected second best to the NHS. So what steps, informed by the current COVID-19 situation, are you taking now to ensure joined-up social care is at the cutting edge of your exit strategy, and that social care will no longer be the poor relation of the NHS?
Thank you very much for that, Tom, and I'm glad you were able to join us again today. It really does matter to me that all our elderly residents, everyone in Scotland, but we're talking here about our elderly citizens, that they receive the respect, the care, and the maximum amount of independence that they wish, regardless of where they live. Whether they're at home, whether they're in a care home, whether they are for limited periods in hospital. That matters. I think that what we have done in the steps that we've taken by increasing the level of National Health Service clinical involvement and support, that experience and expertise in infection prevention and control, available to all our care homes, bearing in mind what Fiona said earlier, that the majority of our care homes do this job very well. But some need additional help and support. I do not foresee that going away anytime soon. I think we need to make sure that that is there for the sake of the residents and the staff. And we need that wider conversation with providers inside government to look at whether or not we need to change or improve in any way the landscape of care provision, be that care at home, be it care homes, whatever it might be, for our older citizens in Scotland. That's a much bigger conversation. I don't have a magic answer to that, but I do believe strongly that it is a conversation that needs to happen. Right now, though, the focus has to be, what more do we need to do to protect our residents in care homes and the staff who work there with them? Committed, dedicated, skilled staff, what more do we need to do to help them do the job that they are doing so very well in very difficult circumstances? Thank you very much. That concludes our briefing for this afternoon. Can I thank all the journalists who joined us? Can I thank Jason and Fiona for joining me? Can I particularly thank you for taking the time on a bank holiday Sunday to tune in to hear what we've got to say? And before I go, can I remind you of those public health messages that apply to all of us about stay at home, only leave for those essential purposes of buying medicine or food or looking after someone who is vulnerable, going out for exercise. You can go out as many times as you want to, staying when you are out 2 meters away from anyone else, not mixing your household with another household, and making sure that we all continue to wash our hands regularly and follow good respiratory hygiene about coughing and sneezing and so on. And in particular, can I also remind you of that vitally important message about what to do if you have symptoms of coronavirus. That's that new persistent cough or a fever or a loss of taste and or smell. And that is to stay at home, to isolate at home. Do not go out at all for 7 days. If you're part of a household, the whole household needs to isolate for 14 days. That really matters, and if you need help, that national helpline is there to help you. Thank you so much to all of you. Thank you to Yvonne, our sign language interpreter for today, but my huge gratitude to all of you for everything you're doing. You're making it work. You're making our country safer. Thank you very much.